Dr. Bill Adams here, and do we have a show for you today? We're going to talk about the newest Botox clients and their millennials. And then we're going to talk about nickel and its impact on certain medical devices. And we've got three incredible experts here to share some insights. We've got Dr. Jason Pozner from Boca Raton, Florida, Dr. Brian Brzowski from Salt Lake City, Utah, and then we got Dr. Jamil Ahmad from Toronto, but he's actually here in the studio with me, so Jamil, thank you. All right, so this is an interesting story. This is about Botox clients, and when people think about Botox and wrinkles and things like that, it's typically a little bit older demographic, but research says that the newest Botox clients are actually millennials. So Jason, lead us off on this one.
You know, I think Allergan is the best drug dealer on the planet. We love them. So what happens in the States when you are part of Brilliant Distinctions and you get breast implants? They give you 50 units of free Botox. So Allergan's doing a great job of promoting to younger patients. So of course, if you get 50 units of free Botox, you're going to use it. With social media, Instagram, there's a lot of exposure for younger patients, younger people to, Botox and things like that. So I think that the low-hanging fruit is probably lip enhancement in the younger patients. And when they come into the office, oftentimes they're starting to see a little wrinkles. I think in the millennials, the most prevalent area that you're going to put toxin is in your glabella, and it's not a factor of lines, it's just a factor of, very expressed patients. So you see someone with a lot of expression, that's the area that you're going to get your Botox, and it's probably going to go along with a little lip enhancement.
Brian, what do you see in your practice? Millennials, you think the millennials coming in?
Oh yeah, for sure. And I do think, as we probably all know, as the millennials are the most clued into social media. They read more, you can argue whether they understand more, but certainly they're more aware of that information that's out there, the products, the things that they can be doing to, enhance their life and to live better. And definitely, I think millennials are discovering what some of us who've had a misspent youth, and there are at least two or three of us that are living examples of that. Jamil still looks like he's 6 years old, so he's probably not lived the hard life that we lived back in the day when, no one used sunscreen, no one did anything to protect their skin, and certainly we weren't doing anything to think about what we were going to look like when we were 40, 50, and 60 years old. And I think those studies that have been done that have shown, the progress in the aging of, twins, comparing, the twin who had a lot of sun exposure, really didn't take care of their skin over the years, and the twin who maybe wasn't outside as much, who maybe did a little bit more proactive things to take care of themselves. And as they've aged, the difference is really, Tommy Lee Jones and one of the Helmsworths. It really is that profound. And so we do know, and we're learning, and I think the millennials are catching on to this, that some preventative things done at an early age can significantly impact how they look when they get older. Botox, I think, is one of the premier elements of good skin maintenance for these patients to be engaged in, so that as they age, they're not really dealing with as deep lines and these hyperdynamic things that have really impacted their skin over the years. I do think they're going to be much better off as they age because they're starting to catch on.
So like you weren't wearing a lot of sunblock when you were playing football for the Georgia Bulldogs?
Oh no. Oh no. Yeah, and I spent most of my time on my face anyway, so that was really blocking a lot of the sun exposure.
Jamil, what are you seeing up in north of the border up there in Canada? You guys seeing these millennials coming back?
In Canada, they're frozen.
Yeah, you don't need Botox to stay frozen, but it's the same trend in Canada as well, and I think it's really generational. We have to remember that Botox has been around now for over 3 decades. So there's a lot of familiarity with the results, with the safety. So for younger patients, they're familiar with this. They also have that recognition, just like Brian said, that it's really about prevention, maintenance, and going forward, it's a lot easier than when the damage is done and you're trying to turn it back. There's only so much that can be done.
That's good stuff. Do you guys, the other thing they say that millennials prefer a subscription as opposed to paying for a single service. Do you guys see that in your practices, or what's Jason? What's your take on that?
It's hard for me to comment because I'm one of the principals at Hint MD. I'm an investor, so I really like that concept of a subscription model. We're actually in my area, it's something that's people would rather pay for stuff, but I think in that millennial model, I think it's fantastic that they're going to stretch things out over a year, especially like $99 a month for lip enhancement really works.
Yeah, and we've been doing a little bit of that here in the office. I don't think it's nearly as sophisticated or developed as what Hint MD and some of the other programs that are coming out are. But I definitely think the millennials are more in tune to, sort of that lifestyle change, that thing that, basically puts them on a path, and it's not an isolated sort of moment in time. They're really trying to do things sort of over I won't say necessarily the long run, but they want to go ahead and make that painful effort, if you will, up front, and then basically be coming in periodically to maintain things for something that they've already paid for.
So when the guys were saying, like, I was talking to this guy that's a millennial and my employee, and he didn't look like he cared. It's not because the guy didn't care, he just can't move his face. He's too much Botox. There you go. Another mystery solved by the Plastic Surgery Channel team. So let's move on to the next one. This is an article by the International Consortium of Investigative Journalists, which assures that it's going to be completely one-sided. But this is talking about nickel toxicity, allergies, and medical implants. Jason, stick with you. Why don't you lead us off on this?
We went through this 15, 20 years ago with the breast implant crisis in the 90s. Silicone did this, it got into your system. They did 1 million studies and they cleared the product. So now all of a sudden it's back that it's causing problems. I mean, we did the due diligence. And listen, we all know that back in the 60s and 70s when silicone came out, the studies were not great. But the studies done in the 90s, they were pretty diligent studies and big numbers of patients and failed to show really any issues with that. Maybe it has a trace element or two. It's still lower than the natural population of trace elements we find in drinking water and other things. So I think that we need to study it a little bit more. We need some more hard data. That study that all of this stuff is based on is this horrible study that we keep going over and over again. The MD Anderson study is certainly something that nothing to hang our hats on of being a great medical study. It's a crappy study. And based on that, they're looking at every little nook and cranny for problems with breast implants.
They mentioned that in this article. It's not even a study because you can't take two different separate studies that were actually poor studies individually and combine them and call it a bigger study. That math doesn't, that dog doesn't hunt, and the math doesn't add up. So, and in fact, that opinion, certainly that I share, was shared by the FDA because the FDA came out and said that was complete rubbish. So
I get asked this all the time in a consult with a patient. And the way I always explain it to the patient, which is the way I understand it, and maybe I'm wrong, is that, look, women of a certain age get autoimmune diseases. If you look at 100,000 women between the ages of 25 and 50, a certain percentage are going to get autoimmune diseases. When you look at cohorts of women with and without breast implants, the same number of women in those cohorts with and without breast implants get autoimmune diseases. You can't say that there's been no association with the women getting breast implants and autoimmune diseases. These are diseases of a certain age group. So we need to split it down again, and maybe there are a few groups of women that are more susceptible.
So this is just this journalistic technique of throwing in the breast implant thing. It's breast implants, there's no nickel in breast implants. I mean, but the thing is this talking about metal hip implants and knee implants, and this Ensure, which is it's a birth control coil that's made out of metal. So, I think that it's kind of like the scandalous thing. Like the minute you mention breast implants, you get an extra, 250, hits on your website. But this is really about metal implants.
Right, and I'm afraid that maybe we've entered into an era in medicine now where the safety profile of any device used has to include zero risk, zero potential complications for it to not be vilified. And again, all of those things that they're talking about that are currently in use for patients. I mean, what's the mortality of being pregnant? I mean, if you think about simple little things like that, or having an arrhythmia for which your pacemaker is designed to protect you from, I mean, your overall risk of death from so many of these things and conditions that these devices are designed to help with, if we again throw the baby out with the bathwater, we're really not going to be left with anything. And that's the whole health side of things. And with aesthetic devices, and perhaps maybe aesthetic devices deserve a little bit more scrutiny because they're not essential for health per se. But as you said, I mean, they're throwing breast implants in with all these other medically necessary and medically beneficial devices simply to sensationalize that. And that's my fear.
Yeah, Jamil, give us your 2 cents. Actually, give us your nickel.
Bill, I have to agree. I mean, breast implants have had a tremendous amount of research behind them over the past several decades. Maybe it's just been long enough that people's memory's a little bit short, that they've forgotten that all of this has happened. Maybe someone's looking for something that's going to be interesting to read about, and breast implants get attention. So I think that's why it's back in the media. But the reality is we have to put science at the forefront, not catchy headlines. And I think as plastic surgeons, we've done a really good job at really taking the lead at using science and putting patient safety first. And that's always going to prevail, I think, in this discussion.
Yeah, well, I think that you guys make some great points. The deal with these metal orthopedic implants is that there are some known allergies and things for certain types of implants. I think most of those implants are not used very often. I think if you look at the people that get orthopedic joint replacement, the increase of quality of life, I can tell you, knowing people in my family have been through multiple different joint replacements, it's such a life-changing treatment that I guarantee you 100% of those people would take the risk of some sort of allergy, because it really does change their lives. So I guess there'll be more to this story, and we'll have to see where it all goes. So those are great. We appreciate you guys' time, and if you want to see more of this, you can see it on the plasticsurgerychannel.com.